More health news. Having a baby has been associated with a slightly protective effect against breast cancer. However, a recent study shows this benefit may take as long as 20 years to kick in. Cleveland Clinic's Dr. Haley Moore says it shows some women actually have a slightly increased risk for developing breast cancer several years after their baby is born.
Compared with women who had not had a child, those women who had given birth had an increased risk of developing breast cancer in the years that followed.
Researchers looked at data from 15 previous studies on women under the age of 55. They found, in comparison with women of the same age who had never had a baby, the women who had given birth had an increased risk of breast cancer that peaked about 5 years later. They also found this increased risk lasted for about 24 years. Dr. Moore says the increased breast cancer risk was stronger in women who were older than they had their first child, or if they had a strong family history of breast cancer. Women who had pregnancies at a younger age did not show the same increased risk. She recommends women, regardless of whether they've had a baby, should pay attention to changes in their body and talk to their doctor.
For all women who may be at risk for breast cancer, I think it's important to be aware of any changes in the breast and report those to your doctors. Women in this age category, many of them are not yet getting screening mammograms and that sort of thing, so it is important to just have awareness of any changes.
Dr. Moore says even though this study shows an elevated risk following pregnancy, it's key to remember breast cancer is still less common in younger women.